Hi, I'm Lisa Prather, and welcome to The Voice of Health with our host, Dr. Robert Prather of the Prather Practice, where lives are changed every day through the natural approach to healthcare. Well, today we're going to talk about prostate health, and this is for all you men out there, but also women. Don't turn off the radio. It's important for you to know also about prostate health. So we're going to just dive right into it, Dr. Prather. What is a prostate?
Well, the prostate, the reason that it gives so much problem is its location. Mm-hmm. It's right underneath the bladder. The colon is right behind it. And in its position, the urinary tract goes right through it, right in the middle.
Okay, so the urinary tract goes right through it.
Right through it. So you've got two different lobes, and they're on either side, and if it gets big and squeezes down on it, that can cause issues.
Right.
And if it gets swollen and inflamed, it can cause some definite issues in your life. I mean, if you can't pee, that's not good.
No. So anatomically, it's not in the great
Well, as
design.
long as it's, it's a great design as long as everything's working right.
Right.
Yeah.
Well, let's talk about what problems can occur with the prostate.
Well, of course, the first one that people think about is prostate cancer. Mm-hmm. That's a huge problem and something that everybody actually thinks of first. The most common problem is a benign prostatic hypertrophy. In other words, it just gets too big. Mm-hmm. And
a large prostate.
In a large prostate. Okay. So that's another different types of problem. And then you can have an inflammation of the prostate called prostatitis. Those are the three problems that you can basically have with a prostate. And if you're having difficulties, those would be the three that you would look to.
Mm-hmm. Now, how common is prostate cancer?
Prostate cancer is diagnosed, there's 233,000 new cases a year. Mm. So pretty common.
Yeah.
It will kill about 30,000 men a year. Mm. It is the second leading cause of cancer death in men, number one being lung. It's more of a cancer as you get older. It's very rare before the age of 40. 6 in 10 men who are diagnosed with prostate cancer are 65 or older.
Okay.
So as you get older, it's much more of a problem. 1 in 36 men are going to die of prostate cancer. 1 in 7 is going to be diagnosed in their lifetime.
1 in 7 men.
1 in 7 men are going to be diagnosed with prostate cancer. And it's not an equal opportunity disease also.
What do you mean by that?
African American men die 3 times the rate of white men for prostate cancer. Oh. So it's much more common and actually leads to a higher death rate. So if you're an African American male and listening to this, it's a much more common problem for you than for others.
Okay.
It is a serious problem, but most men who are diagnosed with prostate cancer, the vast majority, will not actually die from it. Mm-hmm. So one of the most common ways of treatment is watch and wait, and then actually see what occurs at that point. Because oftentimes it can be a slow-growing cancer. Mm-hmm. You basically die of something else oftentimes before that.
You said watch and wait. What do you mean?
Oftentimes, if you're diagnosed from your urologist with prostate cancer, they will sit there and say it's not a fast-growing, vast majority. Oftentimes, they find that the best treatment on that is just watching it, because oftentimes the treatments that can be involved with that, if you do radiation, if you do surgery, there are a tremendous number of side effects that occur on that. An example, I had a gentleman came in. It's a very sad story. He had prostate cancer. It was more of what I would consider a slow-growing. That was a diagnosis. He had a couple different types of choices, watch or wait, or going ahead and do some aggressive surgery and radiation. One of the things that occurred is his wife really pushed him to have the treatment, obviously very concerned and wanted to be aggressive. I recommended a watch and wait type of approach. They went ahead and did the surgery and did the radiation, and one of the things is he developed incontinence. He also, it threw off his hormones quite a bit. There was a tremendous amount of depression. It was just debilitating. Where he was 65, they were actually recommending a rest home because he couldn't control his bowel or bladders. Unfortunately, he committed suicide. you have to weigh the benefits versus the risks and then the quality of life. Because there are a tremendous amount of risks oftentimes with treatments, aggressive treatments.
Right.
So wait and watch as they were observing the quality of life on individuals. If it is at all possible, it's not a fast-growing or there is time on that, to have the best quality of life, oftentimes wait and watch is actually a better way of approaching it.
And we're going to talk about different treatments.
Yes.
Other treatment options. Let's talk about, and I want to make sure I say this right, the inflammation of the prostate. I'm
Sure.
going to say that.
Prostatitis.
Thank you.
Interestingly enough, that's a much more common problem that is a very difficult one because it's oftentimes very uncomfortable with prostatitis. There's burning, there's pain. It is not a pleasant thing to have. And there are actually several different kinds. And about 16% of all the men are going to have a case of prostatitis in their life.
Okay. You said 16%.
About 16%. Only about 7% of that is understood on why it actually occurs. Only 7% is either acute or chronic bacterial prostatitis, which is a treatable disease with antibiotics. But the rest of it, 93%, is usually unknown.
Wow.
And
That's a big unknown.
Yes, and medically, there is nothing that is effective or used. Oftentimes, if you go even to your urologist or try the most aggressive medical treatments, they have nothing for it or nothing that is actually effective. So that is a very big area of concern for men. And I get a lot of patients in here for prostatitis because for the vast majority of them, there isn't really a medical treatment for that.
Okay.
And we've had very excellent results with that.
And we'll be talking about the structure-function approach to that.
Certainly.
And then you had mentioned the benign. Can you go into that?
Yeah, benign prostatic hypertrophy.
Okay.
BPH.
I like that.
You like BPH.
I do. Don't like these big words.
Yeah, well, I know. It's a little confusing on that. And it is the most common issue. And that is something that occurs. 60% of all men have BPH, benign prostatic hypertrophy, at 60. And then at 80, it's 80%. That's a very nice way to...
a nice stat.
Nice stat. So 60% at 60 and 80% at 80. So if you are a male, you are probably going to have benign prostatic hypertrophy. And if you're African American, it's even higher statistics.
So what is it?
If you're talking about African American men, it's about 80% at 60 and almost 100% at 80.
Okay. But I'm asking, what is BPH?
Oh, yes. That is a non-dangerous enlargement of the prostate.
Okay.
Prostate just gets too big.
And that could cause problems with incontinence.
Oh, absolutely. Well, if you get too large of a prostate, it squeezes down on the ureter. So you're not able to get the urine out of the bladder. And if you can't pee, then that's a problem. So just being aware of that and taking the necessary steps. Medically, that is something that they use. Surgery is a very common type of a treatment, can be very effective, but trying to avoid that problem is something that's very, very important to do.
Okay.
And it's a good indication of your overall health and well-being, too.
Well, when we come back, let's talk about the difference between the medical treatment and the structure-function treatment approach to the prostate. You can win a free 60-minute massage in a relaxing spa at the Prather practice. Each month, we have a drawing to give away a free massage to one of our lucky Facebook and Twitter fans. Follow us on Facebook and Twitter on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather practice. What role does structure-function care play in treating infertility?
What we're looking at with the structure-function care is basically there are things that are out of balance in through the system. There are toxins, there are infections, there are other different types of things that could be going on through the system that is preventing the body from becoming pregnant or even carrying a pregnancy to term. Determining what those are, figuring out the proper course, is where we really shine through and just getting people healthy.
So what would someone coming in with infertility, what would they experience? What diagnostics would you recommend?
Very thorough blood test. And we'd be looking at all the different basic functions of the body. We need to know, are there toxicities? Are there infections that are going on? Are there other different types of issues? Toxins. So blood work would be very, very important. We would also need to do a hair analysis. The reason that we're looking at that is there are certain types of heavy metals that are very well known to cause infertility. Lead would be a very direct one, and hair analysis is an excellent way to pick that up. We would also want to do see what's going on in the gut, because that has a lot to do with immune system. Matter of fact, we usually find the key to endometriosis, which is a big reason why women can't get pregnant, coming from the gut. So as we fix the gut, the endometriosis goes away. So that's an important type of way, just really checking the body from head to toe. We need to know what the hormones are doing, just every single different aspect on that. Also, we need to determine the fat percentage of the body.
Does that affect infertility?
It does. You can actually be too low on your fat percentage or too high. The happy rate for best fertility is a body fat percentage of between 20 and 25% for a female. And that's where women are the most fertile. The fat percentage is also a very important part because it changes the pH of the body. It changes the endocrine system. The farther away from that number that you get, the less likely that you would actually be able to get pregnant. Fat will actually produce hormones, and they aren't the good kind of hormones. A male who has a too high of a fat percentage, their fertility rate actually drops.
Schedule your appointment at the Prather practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather practice, restoring hope. You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, the most comprehensive wellness center in the Midwest. Well, today we're talking about prostate health. And Dr. Prather, when you're going over the statistics, they're pretty high. Prostate issues and problems are very prevalent among men.
It's a very, very prevalent problem. When you're talking about, prostate cancer, 1 in 7 men are diagnosed with that. You're talking about prostatitis, which is basically medically an untreatable disease. 16% of men are going to have an issue with that sometime in their life. And then when you're talking about BPH, benign prostatic hypertrophy, you're talking about 60% of all men when they hit 60 and 80% by the time they hit 80. The prostate is not too healthy in the majority of men. There's a problem that's going on. And looking at that carefully to figure out why that's occurring. If you're a male, thinking about treating your prostate on a regular basis is something that you should be thinking about because you're likely to have an issue with that.
Right. And
it can be even life-threatening and very debilitating.
Yeah, and we're going to talk about that, because there are nice treatments for that. But let's talk about the difference between medical treatment and the structure-function model for the prostate.
The difference between the basis of structure function and medicine is a disease-based program. So what you're looking for is something to get the symptomatology under control, something that is like if you have an inflammation, you take an anti-inflammatory. They're there to kill the cancer. That is what they're looking for. Structure function is a dealing with bringing the body back in homeostasis. In other words, we're much more interested in the cause of the problem than the problem itself. Whereas the medical route is they are interested in the problem, not necessarily the cause. So there is a different emphasis on the treatments. Now, Both are very necessary. It is very helpful to have, if you have prostate cancer, benign prostatic hypertrophy, or if you have prostatitis, it's good to actually have an approach from both sides and having those options accordingly. But one of the things that's really missing in people's care is the structure function aspect. And a lot of people aren't aware of it, don't utilize it, don't know where to go. And structure function, when we're talking about the prostate, it really, really is a critical portion of your issue. And every man, once they reach the age of 40, should be thinking about, how am I going to keep my prostate healthy?
Right. And it should be checked how often?
It should be checked at least once a year.
Okay. After the age of 40.
After the age of 40.
Well, how does structure function care work for like prostate cancer?
When we're talking about cancer, of course, structure function is not actually treating the cancer. And I always make sure that any patient who is dealing with a cancer situation, prostate or any others, is that they realize that they need to have an oncologist as they are also seeing us, or a urologist who specializes in that. So as we have an awful lot of men coming in for prostate cancer. We have several that we're treating at this point. They can be in different stages. Some are actively needing treatment because they have an aggressive prostate cancer, and some of those that are in the wait and watch and wait, they're actually being proactive and saying, well, what can I do to make sure this doesn't become a life-threatening situation for me?
Right.
How can I slow down this process? So as we are looking at all those types of situations, there's always a reason for everything. Things just don't happen. Cancer just doesn't happen out of the blue. And that's one of the frustrations that I have from a lot of the patients who came in. Says, as we're talking about the prostate, I have prostate cancer, and I asked my doctor, well, why? And they said, I don't know, that's not important. And that's frustrating to some logical men. And I try to explain their position. That's not their concern. That's not their training. What they are interested in is treating the cancer and not really worrying about the cause. So that's my issue. That's where I come in. That's the structure function model. So as they come in for prostate cancer, there's many things that we look at. We always look for toxicity. And there are many forms of toxicity that can help to kick off prostate cancer. There can be chronic infections. One of the things that is a common bacteria that has been associated with prostate cancer in some of the research, it's controversial, but I find it very true, is tuberculinum bovinum. It's considered a benign bacterial infection, but they do find it 100% of the time in prostate cancers.
100% of the time.
100% of the time on the statistics that I've read. And we do address that homeopathically. There are also some other different types of products that we give. And we've had sometimes some very remarkable results with prostate cancer by addressing that. So
this is an infection that's been in the body.
This is an infection that is very, very common in there, and there is some research that shows that might be one of the causes of prostate cancer. There are other different types of things. There are other different types of toxins. Cadmium toxicity has been linked to prostate cancer, and we have found many of the men who have prostate cancer that seems to be a link, and with some very good results as we detox the body of the cadmium.
And where can they pick up the cadmium?
If you're a welder, that's a great place. I've had people who cleaned their chimneys. Cadmium is actually an ingredient in there, and actually got a strong dose from that. So I've had patients come in along those lines, working in factories. Some of the auto factories, you can actually pick up cadmium toxicity. So we've been able to relate it to several different areas, and sometimes we couldn't find any connection at all. But those are some of the toxins that can be involved. There's quite a few others, but always getting the toxicity down, trying to identify what's going on along those lines. Boosting the immune system. Cancer is controlled by your immune system, so we're always interested in getting the immune system up to par. Along those lines, oxygenation. Cancer cells can't survive in heavy oxygen, so making sure that they're not anemic. Anemia can play a very big role on survivability of cancer. So we always try to make sure that that's up, and the person has enough oxygen going through their system through all the different means that are possible. pH of the body, mainly getting the minerals balanced out, and that has a huge effect on the health of the prostate. Those are some of the major things that we're looking at and evaluating as we look at a situation. And as we always tell our patients who are dealing with prostate cancer, your treatments with your oncologist, we don't actually influence. So, we always insist that you have an oncologist on board, but we don't interfere with the treatments. That's their specialty, and that's on what types of treatments, what things are necessary. We always encourage people to follow the recommendations of their oncologist, but that is not really where we are dealing with. What we are trying to do is to structure functionally get the system working as well as possible.
Right.
A very interesting thing with the prostate is, if you can keep the inflammation down.
Yeah.
Inflammatory types of things are always going to kick up more of a possibility of cancer too. So we're always looking to see what types of other things might be causing inflammation in the system.
Well, let's talk about the structure function treatments you provide for the prostatitis, since we're talking about inflammation.
Absolutely. Making sure that sometimes we can find the cadmium is one of the things that kicks it off. Food allergies is a huge factor for prostatitis that we have found. So checking for food allergies as a cause for that, we've had some very excellent results. We've also found that if we find some infection in through the bowels, that oftentimes has an effect, because you have the prostate is right up against the descending colon, right there at the end of the colon. So there can be some inflammation that transfers from one to the other. Also checking for any sexually transmitted diseases. Chlamydia can be a very big cause of prostatitis, and getting the proper treatments for that. So as we're looking at prostatitis, we look for some of the things that can be inflammatory. Food allergies, the bowels has a huge effect on the prostatitis. We find a lot of results by treating the bowels. And
well, that was interesting. You said the inflammation in the colon can affect the prostate,
because it's in other words, there's several things that can affect the prostate. You've got the bladder that's right above it, and then you've got the colon that's right behind it. And both of those can be a very big effect. So making sure that the bladder, of course, is free from infections and is working properly and has the proper pH. pH has a huge effect on prostatitis. We find that oftentimes the urine is extremely acidic, and if we can get it switched over to an alkaline urine, then we can get a relief on the prostatitis too.
Interesting.
And we've had some very, very annoyed men coming in with prostatitis, and it's
Why do you say annoyed? Is it
well,
painful? Is it?
Yeah, it's very irritating. It's like you have to go to the bathroom all the time, and it can really hurt when you do.
Okay.
So it's a very, very unpleasant, and men who have prostatitis are not usually pleasant to talk to. So it affects, it's just like one gentleman who came in. He was actually young. He was in his 30s, and he says, I've been dealing this with a full year, and it's affecting my job. It's affecting my marriage, because my sex life has gone down. And he says, quite frankly, I'm very irritable. The kids don't want to be around me, and I need this fixed. Not just for the discomfort, but for my whole life, and it's making me depressed. This is not working. So we started him, and we actually worked from several different angles. One, we got the inflammation in the colon down. We got the inflammation in the bladder fixed. We got him on a new diet, and within 3 weeks he was all cleared up.
Wow.
We did some homeopathics too that seemed to be extremely helpful. It was very, very pleasant for him to get that under control, and he got his life back.
That's wonderful. When we come back, we're going to hear more success stories on the prostate. Listen to the Voice of Health Radio on your smartphone or tablet on all of the top radio apps available. TuneIn Radio, Stitcher, and iHeartRadio. You can find these apps and more on our website at thevoiceofhealthradio.com. This is The Voice of Health with Dr. Robert Prather. Laughter is the best medicine.
That little bit of arrogance in the medical community, I think we could all live without. Like when you go to see the doctor, you don't see the actual doctor first. You must wait in the waiting room. There's no chance of not waiting. That's the name of the room. The doctors are all back there. Well, we can't take them now. We've already got this room. And you sit there, you pretend you're reading your little magazine. You're actually looking at the other people. I wonder what he's got. That guy's a goner.
The Voice of Health Minute with Dr. Robert Prather of the Prather Practice.
Vitamin A, I consider probably the most critical vitamin because it has such wide-ranging effects on the health of the individual.
And I don't think you think about that one.
No.
They're promoting D and
Vitamin C and vitamin E. But really, when they're talking about worldwide health and looking at death rates, one of the most important things that they look at is vitamin A. The World Health Organization said that if the children of the world had adequate levels of vitamin A, that they could reduce the childhood deaths worldwide by a third. The biggest things that killed kids is upper respiratory infections and diarrhea. Vitamin A is the best treatment for both of those. When they started to supplement into our diet vitamin A, there was a huge turnaround in the life expectancy of children.
Schedule your appointment at the Prather Practice, 317-848-8048. The Prather Practice, restoring hope. Are you frustrated by not getting to the root cause of your health issue? Are you tired of not knowing why you're always fatigued? Are you wanting to say no to toxic drugs? Have you lost hope? Are you just tired of being sick and tired? At the Prather Practice, we want you to know that we have the answers for you. We offer the alternative to the disease care model. We are the drug-free model to health and wellness. At the Prather Practice, we look for the underlying cause of your health problem and not just the symptomatology. Through thorough diagnostics, we find your individual health blueprint for your treatment. Where the disease care model is symptom-based, the structure-function model we practice gets to the root of your health issue. The Prather Practice is the most comprehensive wellness center in the Midwest. Our integrated practice offers you the most treatment options to restore your health and your hope. Learn more about the Prather Practice by calling 317-848-8048 or learn more on our website at thevoiceofhealthradio.com. I'm Lisa Prather, and you're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where we get to the root cause of your health issue. Well, today we're talking about prostate health. Dr. Prather, we were talking about the structure-function approach to treatment. For the three, we're talking about prostate cancer, prostatitis, and you said the most common is the BPH. Mm-hmm. And what is the structure-function treatments available for the BPH? Which has the highest, incidence, yeah.
Yeah, and one of the biggest things with benign prostatic hypertrophy is that is low testosterone. Or it's an imbalance on how the body actually utilizes the testosterone. Mm-hmm. Sometimes that can be converted. There's some abnormalities along those lines. Mm-hmm. But there's a very direct correlation between the health of the hormones of a male and whether they develop BPH.
Is that called menopause?
Menopause.
I just on the Time magazine.
I know. It's really the menopause that causes BPH.
Is this a a Time magazine term, or is this going to be a new term?
Actually, I've read that elsewhere. So that was actually brought up in some scientific circles, and something that, of course, Time magazine said, "Oh, that's cool. That'll catch people's attention."
Yes. So women have menopause and men have menopause.
I guess so. But there is a hormonal shift that occurs that really does lead to not only BPH, but it's also very much associated with cancer too. So if there's a higher level of estrogen in a male, your chances of actually getting not only BPH but also prostate cancer. So hormones are absolutely critical. Matter of fact, one of the most effective treatments for prostate cancer medically is hormone therapy, and keeping that under control. But if you actually have normal, healthy hormones, you do not get the changes in the prostate that lead to a lot of the diseases. So looking at the hormones, keeping that up is one of the critical types of things, and that is one thing that we definitely look at. We check to see what those hormone levels are, and if you can raise up a man's testosterone level and the whole health of the hormones, then most of the time benign prostatic hypertrophy goes away.
Interesting.
There are other different types of things that you can do that definitely help with the inflammation that's associated with that. So you can approach it from the aspect of the hormones. Then you can also approach it from the aspect of the inflammation. And, of course, the most popular product along those lines is saw palmetto.
Saw palmetto,
Yes.
supplement.
It's something that is very well proven and well known to help with that. So that's a very common type of a treatment and actually very effective. There's some other things. There's a bark from an African tree. It's called Pygenum africanum. And that is a very common supplement that is taken, herbal, that also has some good anti-inflammatory properties to that. So that is something that is commonly used along with the saw palmetto. Stinging nettle is a very well known for all sorts of inflammatory conditions.
That's an herbal also.
That's an herbal too. Sinuses, prostate, very effective. Pollen extract. Rye pollen is something that is also used quite often and is very helpful along those lines. But you also need to look at the whole nutritional needs too.
Yes.
Because there's a lot of things that can affect the prostate nutritionally. You've got the fatty acids. It's very critical that you have the right balance of the fatty acids, that you have the enough of them, because fatty acids also play a very big role in the balance of those on the hormones. Hormones are basically made up of fats, and if you have abnormal nutrition, abnormal balance of your fatty acids, if you take in too many meat fatty acids, then you're going to have an imbalance and you have a greater chance of having cancer. So getting the fatty acids checked and getting that balanced out is very effective. Minerals play a very big role. We had talked about the toxicity of cadmium, but if you're low on zinc and selenium, that plays a very big role in the health of the prostate. The prostate actually carries the largest concentrate of zinc and selenium in the body, almost 10 times greater than the rest of the system. So if you get a deficiency along those lines, then that is something that is shown to increase the chances of benign prostatic hypertrophy. And also there's some studies that show up that it can be important for the prostate cancer, and then also something that's important for prostatitis. So we had a gentleman who came in. Actually, he's going to be going to for surgery today for his benign prostatic hypertrophy. It was not something that he went willingly, but we said, we really need to do this. But we've treated him for about 5 years, keeping that under control. When he went in and had it checked, because we had it checked immediately, the urologist said, we're actually sending it to the university because we've never seen one that big. It was the size of a grapefruit.
Wow. Ow.
Just kind of, all the guys kind of went, ooh. And but we were very definitely been able to control the symptoms that are associated with that. Good urine stream,
For 5 years.
For 5 years. Where, he's very adverse to medical treatment. And a lot of people seek out our care who are, and was not really willing to do, the prostate surgery. One of the things is that they've improved that quite a bit with the lasers, and it's a much easier process than before. He had friends who had gone through it, and they had all said, do not do that. You're being treated quite well, and you don't have that many symptoms. And he was saying, that, he was telling us, I'm doing fine with this. All my symptoms are gone. Even though it's enlarged, I don't have any of the problems that are associated with it. So I would rather go natural. And with the advances in the surgery, I said, we're working real hard, we're doing real well, but with the new advances, I think you should just go on ahead and have it done. So he's having that done today. But if we can do that for him, we can basically do that for everybody.
So he didn't have any incontinence problems with that?
No, any problems with his urination. Of course, his sleep was being disturbed because we had him there for a while where he wasn't even getting up at night, and that's one of the most common. That's the big thing that men complain about with benign prostatic hypertrophy (BPH) is they're getting up at night and going to the bathroom. And he had gone about 4 years without having to do that. And that was starting to disturb some of his sleep. I felt it was causing some health issues. He was getting up about 3 times a night, and if we can get that taken care of, then that would be the best way to approach that.
Yeah.
So, that's one of the big things, and if the products that we've been using, amino acids are very good. Glycine, alanine, glutamic acid are excellent along those lines. There are certain homeopathics that are wonderful for it. Clematis, pulsatilla, thuja, apis mellifica are all very, very good homeopathics for that. Acupuncture is fantastic. Chiropractic adjustments.
Where do you put the needles?
No place that anybody would be embarrassed about. Most of that is on the legs and on the abdomen. So people the guys still get to keep their undershorts on if that's what you're thinking. Mental picture, got to erase.
Well, what is the success rate with structure function medicine approach for improving the prostate?
One of the things that we're doing is making improvement, and I would say that for the treatments, they always bring the body back into greater homeostasis, and as we do that, we're going to see an improvement on everyone. Now, it's not always a cure. We have had people through the structure function. Because the body was able to get back into homeostasis in such a efficient means that the body took care of the cancer. Benign prostatic hypertrophy, we make a very, very significant difference on everyone who has that with the products. They all work, and we find out exactly which ones. We have probably over 120 overall products that can work along those lines. We can find out exactly which ones work. We always make improvement. Doesn't mean that won't have to have medical treatment, but yes, we always make improvement in the system. So it's 100% improvement.
Great. When we come back, let's talk more about prostate health. Never miss an episode of The Voice of Health so that you can stay informed and empowered about your health. Get a podcast of our show automatically delivered to you every week by signing up for our show on iTunes. You can find that link on our website at thevoiceofhealthradio.com. And don't forget, thevoiceofhealthradio.com has complete archives of all of our past episodes with an audio library of information to help you add more life to your years and more years to your life. This is The Voice of Health with Dr. Robert Prather. The Voice of Health Wellness Tip with Dr. Robert Prather of the Prather Practice.
One of the most basic fundamentals that I base my practice off of is something called the Atlas orthogonal. technique.
It's the type of adjustment.
It's a specific type of an adjustment, and orthogonal means at right angles. In other words, the head is sitting on top of your body.
That's a good thing.
And that's a good thing because about 80% of the people don't have that. And it has probably one of the greatest effects on the entire system.
You're saying 80% of people don't have the
atlas sitting on underneath the skull.
Now, the atlas
properly.
we're talking about is the first vertebrae.
First vertebrae under the occiput. So a basic type of thing, and what I found is that probably has the biggest effect on the health of an individual over anything else. So you can actually make the greatest amount of changes with the atlas, getting it in the right position, because it's right there at the base of the skull, which is the center of the autonomic nervous system.
The base of the skull.
Which actually controls all the functions of the body. So the atlas orthogonal is one of the big bases of what we do and has the biggest effect on the health of the individual. And really, to make any types of changes in the rest of the system to help the body to work correctly, that's the beginning of where you need to start. And when I'm actually working with patients, I make sure that that's in position. Now, of course, 20% of the people don't have a problem with that. So we go on to
So not everybody that walks in the office has that issue.
And not everybody who walks into the office has that issue. But getting that corrected is absolutely essential for me to make the other postural changes and to make the changes in the system.
And I want to bring up here, you're board certified in the Atlas orthogonal technique, the only one in the state of Indiana. Got your training down in Atlanta.
Right.
So extensive training.
I was one of the original 6 in that. So that's a huge basis. So there's a very strong belief system in that. And then also I had my greatest amount of changes in my health through this particular type of adjustment. So I can speak from a personal type of standpoint.
Find out how the Atlas Orthogonal Chiropractic Adjustment can transform your health. Schedule your appointment at the Prather Practice, 317-848-8048. That's 317-848-8048. Or learn more on our website at thevoiceofhealthradio.com. The Prather Practice, restoring hope.
Don't stop believing. Woman to that freedom, yeah. Street lights, people.
You're listening to The Voice of Health with Dr. Robert Prather of the Prather Practice, where our mission is restoring hope to our patients. Well, today we're talking about prostate health. And Dr. Prather, we were talking about the structure-function approach to prostate health. Let's talk a little bit about the diagnostics that are important for structure-function care of the prostate.
Absolutely. First importance for the prostate is hormones. So getting good hormonal tests, finding out blood work, of course the PSA. And then there's also something called the PAP, prostatic acid phosphatase, which is a good measure of cancer in the prostate. So PSA,
those are all
PAP,
blood tests.
Those are all blood tests. Also hitting the hormones, making sure that testosterone is at its proper level, non-toxic estrogen, getting a full run on that. So blood test and urinalysis, a combination on those can give us a very excellent picture. The ability of the body to detox the liver enzymes are actually very important. So if you can detox the liver, that really helps out the prostate quite a bit. So that's another area. We touched a little bit on heavy metal toxicity. Hair analysis is a great way to check on that. Cadmium is extremely important. Also checking on the zinc and the copper levels plays a very big role on prostate health. And we also touched on the point that the bladder plays a role, so urinalysis is extremely important. And then also colon health, because the prostate is right up against the colon. There's a huge amount of effect on that. Colon has a great deal of effect on the immune system for both prostate cancer and for prostatitis. So doing a stool culture and finding out the health of the bowels is very critical along those lines too.
And I think when people think, and correct me if I'm wrong, men, it's hormonally, they're just thinking testosterone, but there's so much more involved hormonally for men too.
Yeah, absolutely. You need to see, and there are different ways you can. One of the common things that can occur is if you're taking testosterone supplementation, medicine along those lines, you can actually run into quite a bit of problems with the prostate. Because just because you're taking it in doesn't mean the body's going to use it that way. It might convert it into a toxic form of estrogen. It can kick off a lot of problems. So when you're dealing with the hormones, that's a very, very intricate, balanced type of a process. You need to have thorough tests. You shouldn't just be taking things willy-nilly. It's you're playing with major things in the body.
I haven't heard that willy-nilly for a while.
That's a technical term.
Technical term. Right.
So being thorough and structure function care is very dependent upon lab tests. Because if you don't know how the body is imbalanced, then you don't know how to make that correction.
You call that your blueprint.
It is. It is. And we're actually do more diagnostics than the disease care because we need it more. We need to know how the body is off, and then we also need to know when it's corrected, if it's heading in the right direction. And
what I like about it, too, it's affordable type of diagnostics.
Yes.
Not out the roof or.
Yeah, it can be paid for out of pocket if necessary.
And a lot of times insurance picks it up.
Yes, most of the time.
Well, let's talk about the different things that might play a role in prostate health. Let's start with, how about obesity?
Oh, obesity is just absolutely huge for the prostate. It's very difficult to be obese and have a healthy prostate because fat has a very strong effect on the toxicity levels. It also has effect on the hormones. It's hard to keep your testosterone level at its proper level if you are overweight. Also, if you have a waist measurement of 40 or greater, your chances of having prostate problems increase dramatically. So keeping your weight under control is an absolute essential portion of your prostate health. And one of the things that for men who have benign prostatic hypertrophy or men who have prostate cancer, if they are overweight, getting that under control can make an immediate change.
Yeah, and what's nice is we're offering a weight loss program at our office and seeing some great results with that in this area because obesity, they're classifying it as a disease. It's prevalent, especially here in Indiana.
Yes, it is.
And causing so many other health issues. How about the role that diet plays?
Diet. One of the biggest factors that are involved with diet is fiber. Again, we had talked about the health of the colon, and the health of the colon is very intricately related to the health of the prostate. So fiber helps, cuts down on colon cancer. It also cuts down on prostate cancer and prostate benign hypertrophy. So what type of diet you have, if you eat a fast food diet, you're going to have prostate problems.
There's such a thing, fast food diet. Oh.
Absolutely. If you are eating healthy, eating your fruits and vegetables, getting your level of fiber in, getting good fats into your system, your chances of having prostate problems reduce quite dramatically. So diet is absolutely critical. Certain things in diet can play a big role, so we can help to advise. Tomatoes have lycopene in it. So that's a great way to improve your prostate health. There's a lot of different types of things that we can do. Even according to the hormone shift, what type of diet can play a role on how you respond. A heavy soy diet can actually cause some prostate problems because it increases your estrogen content.
A heavy soy diet can cause problems.
Yeah. So a lot of the processed foods, a lot of the things that they add to what your diet would normally be can play a very big role in your prostate health. I've had several men that we had to get them off of soy to get their prostate under control.
Yeah, I know soy is an issue with
Sure.
hormonal imbalance, and you have to watch the intake.
Absolutely.
How about exercise? Is exercise important to prostate health?
Exercise is something that if you are in good shape, You have good aerobic exercise. You have good muscle mass. The higher the ratio is to muscle to body mass, the less prostate problems they have.
It goes back to fat.
It does. It does. So exercise, keeping that up, that plays a role on your hormones too. If you exercise, it helps to keep your weight down, balances out your hormones. It cuts down on insulin intolerance, which does play a role on prostate health. So in so many different types of ways, as I've always said, exercise cures a world of sins. So keeping a regular exercise program will really help your prostate.
Yeah. And I came across this app called Couch to 5K. And it's a really nice, I felt like I needed a goal, and I want to be in a 5K race. And it's just nice walk, run. They take you right through it 3 times a week. And that's been helpful, for me and moving me toward a goal like that. So
Excellent.
Anybody out there might want to check its Couch to 5K, not couch to kitchen. But let's talk about stress, the role stress plays in prostate health.
And there is some very, very good research that stress increases the chances for prostate disease. One of the things that a gentleman had prostatitis, and we can actually tell someone's stress level from their blood test, and stress level changes your pH of your body. And I said, really, we have to get your stress under control to get this effective. So we gave him some things, made some lifestyle changes, and we're able to get the prostatitis under control. But if you don't deal with the stress, then that can change your hormone levels, increases your cortisol, makes the hormone changes so that you actually become more susceptible to prostate issues. So living a stressful life does cause disease, and something that oftentimes can be the underlying issue. And like I said, if there were several cases of men that I can think of that their underlying problem for their prostate was directly related to their stress levels.
Was some of that stress being suppressed, or?
Yeah, also, just, it was ridiculous the amount of hours they were working, and, there just needed to be some changes in their life.
Okay. And how about the role of sexual activity? What role does that play in the prostate?
Well, actually, when you are more active sexually, then you have a better, healthy prostate. So a good sex life is important. One of the things that's very true is that if you have a monogamous relationship, you actually have better prostate health. The reason is that there is sexual transmitted diseases that can occur that can play a very big role in prostate health. The more STDs you have, the higher the chances you have of actually having prostate problems.
So you're going to say, now men are going to use the excuse, come on, honey, for my prostate health.
Oh, can I? Yeah,
Can you use that one?
That actually I think is a pretty good idea. But you do want to keep me healthy, right?
Right. Keep you around for a long time. Well, Dr. Prather, we have a few seconds here, and how would you like to conclude on prostate health?
Men really should be getting their prostate checked at least on a yearly basis from 50 on. So keeping healthy on that, getting your blood checked, and knowing that it is something that if you don't take care of it, it will become a problem for you.
Okay. Well, thank you, Dr. Prather, as always. The Prather practice is located at 8902 North Meridian Street on the north side of Indianapolis, just south of the I-465 loop. If we can help you to achieve better health, we'd love to hear from you. Connect with our office at 317-848-8048. That's 317-848-8048. Join us again here next week or anytime on our website at thevoiceofhealthradio.com for The Voice of Health with Dr. Robert Prather.